Thank you, Tom. Joining us via Zoom is Mylynn Trulock from the Medical Care Access Coalition, which serves residents in Dickinson and Iron counties. Mylynn, could you tell us what the coalition is exactly?
The coalition was started in 2004, and it was to help provide health care and prescription medications to people who couldn't afford it. And it's kind of with the inception of the Affordable Health Care Act, we kind of changed our focus a little bit. We have become unbiased free Medicare and Medicaid counselors, helping people navigate Medicare and Medicaid is difficult. There's mountains of paperwork, um, as well as providing millions of dollars to people in our community of free medication directly from the drug company. So typically on any given year, we provide people with over $2 million in free meds. So that money is freed up to go back into the community and help people afford, rent and food and things like that. So we're blessed. We're supported through the Dickinson and Iron um, millages for the healthcare benefits. We're a free service.
What does this coalition mean to people who utilize it?
Not too many of us are afforded to be able to work for a nonprofit who can actually benefit anybody. It's not based on only income. I mean, obviously, the drug companies do have income guidelines, but we help anybody who is having problems affording their medications. We help anybody that doesn't understand the paperwork and what's involved. Um, a lot of the services that are available in the community are web-based. So we have a lot of elderly who cannot use the computer, don't know how. Um, so we're there to help with those as well. So it's so nice because people come into our office, they're scared. Nobody wants to ask for help. But the fact of the matter is, it doesn't matter how much money you have. There's so much paperwork, and they sit down with us for a few minutes and they're like, "Oh, that's what that means," you know? And so we can make a difference every day. And we've been doing it for 20 years. And everybody in the community could truly benefit from our services. So we want to make sure that everybody out there knows that these services are available as well.
Open enrollment is coming up. What does that mean for your cause?
A lot of times what people don't understand is the medication copays are also based on your insurance. So maybe you're in the wrong insurance plan, or you are using a pharmacy that's maybe not a preferred pharmacy for them. So open enrollment is coming as well. And we would like to urge everybody to please check your plans to make sure that they're going to be the most cost effective for you going into 25.
This year, you're celebrating 20 years of the Medical Care Access Coalition. How are you celebrating this milestone?
We are having a big party. We are having our 20th anniversary party and open house on Wednesday, September 18th from 1 to 4 at our new office location at 2301 Woodward Avenue in Kingsford. It is open to the public. We would love to have you stop in, ask questions, learn about our program, help support our program.
What is the best way for people to get a hold of you to utilize your resources?
So the best way to get a hold of us is to call at 906-776-5412. Our main branch is in Kingsford, but we do also have an office in Iron County that's staffed by appointment. A lot of times we can do it over the phone. We know in the wintertime it's not easy to get around in the UP. So a lot of the questions that people have, we're happy to do them over the phone as well.
Thank you, Mylynn, for sharing those details with us. You can also find them online at dimac.org. We'll be right back with more My UP Mornings.